I spent over a decade working as an emergency room physician. I saw heart attacks, strokes, diabetic crises, kidney failure, amputations, you name it. Over time, I began to realize something uncomfortable. The Western medical system is extremely good at saving people in crisis. We are very bad at creating health. The system is built around escalation. If your blood pressure rises, add a medication. If your blood sugar rises, add a medication. If your cholesterol rises, add another medication. If those medications cause side effects, add more medications. It becomes a cascade. I routinely saw people taking 5, 8, 12, 15 medications a day, not because they were irresponsible, but because the system they live in is designed to manage their disease, not to reverse it. In medical school, I received hours and hours of lecture on pharmacology. I was trained extensively in drugs, and drug mechanisms, and drug dosing, and drug interactions, and emergency protocols. Do you know how much education I received on nutrition? Almost none. Outside of total parenteral nutrition, which is food given through a vein when someone can't eat, nutrition was barely discussed. Food and food quality were never mentioned. We were not trained in metabolic flexibility, and we were not trained in behavioral change architecture. We were not trained in long-term lifestyle intervention models. We were trained to stabilize and prescribe. There's also an uncomfortable cultural belief inside of medicine that patients are non-compliant, or that they won't change, or that they're too lazy. That patients are non-compliant, or that they won't change, or that they're too lazy, or too stupid, or too unmotivated to do the hard work. So instead of building systems that help people change, we default to medication escalation. Not because doctors don't care, but because the system assumes behavioral change won't happen. The insurance reimbursement model also drives much of this. Physicians are reimbursed for visits, procedures, prescriptions, and diagnostic coding. We are not reimbursed for 2-hour comprehensive health history taking, for weekly coaching, for deep nutrition planning, for lifestyle restructuring, for preventative optimization. A 7 to 15-minute visit is financially rewarded. A 90-minute metabolic deep dive is not. That model shapes behavior. The system pays for sick care. It does not incentivize health creation. Every medication has trade-offs. Some blood pressure medications can cause fatigue and erectile dysfunction. Some diabetic medications can cause weight gain and gastrointestinal distress. Some hormone treatments suppress natural reproduction. When these side effects appear, another prescription is often added to manage the side effect. I saw this constantly in the ER. Polypharmacy becomes normalized, but very few people ask, why are we not addressing the upstream cause? I was told during training that supplements were just expensive urine. And to be clear, many supplements are overhyped, but dismissing all micronutrient optimization without evaluating deficiencies, metabolic demand, or inflammation is intellectually lazy. There is nuance, and nuance is often lost in a system optimized for speed. Over time, I became disillusioned. I kept seeing the same patients return, sicker each year, more medications, more complications. We are excellent at crisis response, but not at preventing the crisis. That is why I built Xylem Wellness Systems. At Xylem, we focus on health creation. We do comprehensive metabolic testing, low-carbohydrate whole food nutrition, continuous glucose monitoring, hormone evaluation, structured accountability, physician insight, physician oversight, and medication when appropriate, but always with a plan to reduce dependence as physiology improves. We work directly for our patients, not insurance reimbursement codes. That changes everything. The Western healthcare system is not evil. It is structurally designed to manage disease. If you want restoration, optimization, or reversal of metabolic dysfunction, you need a different model. That is why Xylem exists. If you are a Texas-based male, ages 30 to 65, and you have type 2 diabetes, prediabetes, or obesity issues, and you're ready to move beyond perpetual escalation to build actual health, schedule a strategy consultation below, because saving your life in a crisis should not be the first time healthcare shows up for you.